25-year-old young male patient presented to the neurosurgery outpatient department with the complaints of chronic headache and diminution of vision of left eye. General examination was found to be normal. No thyroid enlargement was found. Systemic examination was found to be normal. Ocular examination revealed that visual acuity in the right eye was 6/6, in the left eye was 9/36, respectively. Extraocular movements were of full range. Fundus examination was within normal limits. There was no mass palpable in the orbit or no bruit. On examination, computed tomography scan revealed sellar mass with suprasellar extension and involvement of adjacent structures and vessels, suggesting the pituitary macroadenoma. MRI showed large, intense, homogeneously enhancing dumbbell-shaped sellar and suprasellar mass lesions with bilateral parasellar extension enclosing the cavernous segment of internal carotid artery on both sides. Hormonal assay was carried out. Prolactin levels was found to be 180 nanograms per ml. Normal range in the males is almost 4.6 to 21.4 nanograms per ml. Thyroid profile was found to be normal. Now, what is the accurate diagnosis? How will you further investigate and treat the patient? To learn the answers to these questions, let's study Sellar Masses in detail on sqadia.com.